We are Blue Zones Project. Our vision is a happy, healthy Hawaii where people are empowered to care for each other and their community. Ultimately, we want you to live longer, better. In Blue Zones areas, the places in the world where people live the longest, they don't try to live longer, it just happens to them. Blue Zones Project is built on these well-researched longevity secrets of these areas and brings them to life in our neighborhoods, homes, and families. We know that only 20% of how long an individual lives is because of their genes. The other 80% is lifestyle and environment. Our mission is to enhance the well-being of Hawaii's people by continually improving the environments where we live, work, and play to make the healthy choice the easy choice. We embarked on this mission in 3 small communities in 2015. Through a local grassroots effort, we work to provide healthier options in the areas we frequent most. If healthy choices are convenient and accessible at your school, workplace, or grocery store, won't they become your default choice? Yes, we found this to be true throughout the community and in our social networks. We quickly grew and since 2015 have impacted more than 110,000 people and volunteers throughout the state in 8 communities on Maui, Oahu, and Hawaii Islands. We've also helped over 1,000 businesses implement well-being practices throughout their workplace, many of whom started walking groups, provide healthier options at work, and encourage coworkers to connect and gather socially. This has resulted in numerous improvements to the bottom line for these work sites. Across Hawaii, BZP employers such as the Queen's Medical Center West Oahu, Hawaiian Telcom, and the County of Hawaii have seen a 34% reduction in turnover, 27% decrease in obesity among employees, and a 60% increase in average employee performance. In fact, we've seen dramatic positive outcomes since our baseline measurement year in 2015. Chronic disease factors such as BMI, nutrition, and life evaluation that are proven to drive medical costs and productivity have decreased by 8.8%, equivalent to a projected $39 million in overall value related to decreased healthcare utilization and increased productivity, with a projected savings of $434 million over 10 years. We address social determinants of health by working with community partners to implement best practices for people, places, and policy within an individual's life radius, or the places near their home where they spend their time. These places include grocery stores we shop in regularly, the schools our children go to, and the sidewalks we use on a daily basis. Collectively, our Blue Zones Project communities have generated over $5.5 million in grant funding to improve the physical environment and assist those in need. Today, we face the challenge of rebuilding what the COVID-19 pandemic tried to ruin: our health. After experiencing the highest unemployment rate in the country and being engulfed with stress factors that are out of our control, we must rebuild. With a renewed respect for connection and a heightened sense of overall well-being born out of 2020, it's more important than ever to prioritize our health and wellness as we move on from the pandemic that affected the entire globe. As we forge ahead, our focus is to leverage our proven strategies that have improved well-being in our 8 communities to expand this critical work throughout the state of Hawaii. We want to build upon these successes created over the past 7 years and continue to harness the energy of our community leadership teams and network across the islands to rebuild, refocus, and revitalize our home state. We continue to work with schools and work sites to support the lives of our keiki and their families through educational well-being resources, healthy food access, and overall well-being support in their community. In identifying recent recovery funds at the state and county level, we will focus on supporting those in need, those who have been impacted the most. Through partnerships with primary care providers, we're identifying, locating, and engaging residents in poor health who can benefit from participating in Blue Zones Project programs. Although we have been handed an enormous challenge, we are faced with an inspiring opportunity to improve the lives of the people we care about most. We hope that you will join us as we strive to motivate healthy changes that will enable us all to live longer better, just like those who live in the Blue Zones.